His name was Walter. He was 71 years old, a retired bus driver from Ohio. He had been married for 44 years. He had 2 daughters, 3 grandsons, and a habit of waking before sunrise even after retirement. He liked the house quiet. He liked the coffee hot. He liked to start the day before anyone else was awake. On the morning he died, nothing seemed unusual. His wife heard the bedroom door open. She heard his slow steps move down the hallway. She heard the bathroom door close. Then she went into the kitchen and started the kettle. She expected to hear him clear his throat, expected to hear the faucet, expected to hear his chair slide back from the table the way it had thousands of mornings before. She waited and waited. He did not come out. 3 months earlier, he had seen his doctor. His blood pressure was not perfect, but it was controlled. His cholesterol was being monitored. He was taking his medications. He had been told to walk more, eat better, reduce stress. Nothing in that appointment prepared him for what happened next. Walter did not die because he was reckless. He did not die because he ignored crushing chest pain. He did not die while shoveling snow or running on a treadmill. He died during one of the most ordinary moments of the day, a moment so common, so deeply routine, that almost nobody thinks of it as dangerous. But for adults over 60, under the wrong conditions, that one small mistake can become the trigger for a heart attack or a stroke. My name is Dr. Caleb Mercer. I'm a physician, and for many years I have worked with older adults who want to understand what is actually happening inside their bodies, not just what they have been told to ignore as normal aging. What I'm going to explain today matters, because by the end of this video, you will understand what that mistake is, why it becomes more dangerous with each decade after 50, what warning signs many people dismiss for years, and what simple steps may reduce the strain you place on your heart first thing in the morning. Please stay with me through the entire explanation, because the most important part is not the mistake itself. It is why it becomes so dangerous in the early morning hours. And most people have never had that explained to them. Before we talk about the mistake, you need to understand one thing. Your cardiovascular system does not wake up slowly. Long before you get out of bed, your body is already shifting gears. Hormones begin preparing you to wake. Blood pressure starts to rise. Heart rate begins to increase. After a full night without water, your body is relatively less hydrated than it was the evening before. And in many older adults, that means the heart begins the day working in a system that is already under more pressure than people realize. That early morning window matters. Because if you are over 60, your arteries are usually not as flexible as they were at 40. Your pressure sensors do not respond as quickly as they once did. Your body can still adapt, but it often adapts with less reserve and less speed. That means sudden strain in the morning can hit harder than it used to. Now here is the mistake. Holding your breath and straining hard during a bowel movement. That is the mistake. Most people never think of it in those terms. They think of it as pushing, trying a little harder, getting it over with. But medically, what many people are doing in that moment is creating a pressure event inside the chest and cardiovascular system that can sharply stress the heart and blood vessels. This is commonly known as a Valsalva maneuver. You close the airway, you hold the breath, you bear down. And inside the body, that is not a small event. It may feel brief, it may feel harmless, but it is not nothing. And in an older adult with high blood pressure, stiffened arteries, plaque buildup, dehydration, constipation, or an already vulnerable cardiovascular system, it can become the spark that sets off something much more serious. Tomorrow morning, pay attention to this. Notice whether you hold your breath without realizing it. Notice whether you strain harder than you think. Because most people do not recognize they are doing it until someone points it out. Let me explain what happens. When you hold your breath and bear down, pressure inside your chest rises. That pressure affects how blood returns to the heart. The heart and blood vessels then react. Blood pressure can swing. The heart may suddenly work harder. Then, when the strain stops and breathing resumes, blood flow shifts again. So instead of a smooth, stable morning transition, the cardiovascular system gets hit with a sudden mechanical stress. In a younger body, that stress is often absorbed. In an older body, especially one carrying years of plaque inside the arteries, it may not be absorbed the same way. That is where danger enters. Because heart attacks and many strokes do not happen simply because plaque exists, they happen when a vessel becomes blocked. And sudden pressure changes, combined with vulnerable blood vessels, can create the kind of unstable environment that the heart and brain do not tolerate well. I want to be careful here. Not every person who strains will have a cardiac event. Not every episode leads to disaster. But what makes this important is that millions of people repeat this exact behavior every day without knowing it increases stress on the cardiovascular system at one of the most sensitive times of day. That is the part people deserve to understand. I once spoke with a man I'll call Raymond. He was 69, retired, quiet, practical, not the kind of man who complained much. He told me that some mornings, right after using the bathroom, he would feel a sudden pounding in his chest. Not pain, just pounding. Sometimes a little dizziness. Sometimes he would stand there for a moment with one hand on the sink until it passed. He had normalized it. He thought it was age. He thought maybe he stood up too fast. He thought maybe it was coffee. But when we looked at the pattern was clear. The episodes were clustered around one specific moment. Breath holding, straining, morning pressure. That window, that one small routine. And once he understood what he was doing, he looked at me and said something I have heard many times in different words. "I've been doing that my whole life. Nobody ever told me it could matter." That is exactly the problem. People are warned about salt, warned about sugar, warned about cholesterol, but almost nobody is warned about the physical stress they create with their own breathing and straining habits in the bathroom. And after 60, the body is less forgiving. There are several reasons this becomes more dangerous with age. First, constipation becomes more common. Less fiber, less fluid, less movement, more medications that slow the gut. That means more people strain, more often, more forcefully. Second, blood vessels become less elastic over time. They do not cushion sudden pressure changes the way they once did. Third, many adults over 60 wake up with blood pressure already rising into its highest zone of the day. So the mistake is not happening in a neutral moment. It is happening during a loaded physiological window. And fourth, people often dismiss the body's warning signs. That may be the most dangerous part of all. Because the body usually speaks before it screams. Let me give you 4 warning signs many people overlook. Warning sign number 1, a pounding, fluttering, or irregular heartbeat right after a bowel movement. If your heart suddenly races, skips, flutters, or feels unstable in the minute or two after straining, do not casually dismiss it. That can be a sign that your cardiovascular system is reacting badly to the pressure shift you just created. Warning sign number 2, dizziness, dim vision, or feeling briefly faint in the bathroom. That is not something to laugh off. That is your body telling you the pressure change was significant enough to affect circulation. Warning sign number 3, morning headaches or a feeling of pressure in the head soon after waking. That may have several causes, but persistent early morning head pressure deserves medical attention, especially in people with hypertension or vascular risk factors. Warning sign number 4, exhaustion or heaviness right after the bathroom, as if the day has barely started, but your body already feels drained. Many people call this aging. Sometimes it is not aging. Sometimes it is recovery from avoidable cardiovascular stress. If you regularly experience 2 or more of those signs, especially if you are over 60, have high blood pressure, or have a history of heart disease, talk to your doctor. Not in a vague way. Specifically mention what happens during or after straining in the bathroom. That detail matters more than people realize. Now I want to give you something practical. Not a supplement, not an expensive gadget, not a miracle promise. Just a simple morning safety routine that may reduce the likelihood of turning a normal body function into a dangerous cardiovascular event. Here is the protocol. Step 1. Hydrate before you force your body into effort. When you wake up, drink water before coffee if your doctor has not restricted your fluids. After a night of sleep, many people start the morning relatively dry. Hydration will not solve everything, but it may improve the environment your cardiovascular system is operating in. Step 2. Do not jump out of bed and rush. Sit up first. Give your body a moment. Let your circulation adjust. Stand slowly. That alone may reduce one layer of stress before you even reach the bathroom. Step 3. Do not hold your breath and bear down hard. This is the big one. Exhale gently. Breathe. Do not turn a bowel movement into a pressure contest. If nothing is happening, forcing it is not the answer. The harder you push while holding your breath, the more stress you may place on the heart and blood vessels. Step 4. If you are constipated, fix the constipation, not the moment. That means reviewing fluid intake, fiber, movement, and medications with your physician if needed. Because chronic straining is often a symptom of a bigger daily problem, not something you should battle through every morning. Step 5. Use positioning to reduce effort. Many people find that raising the feet slightly with a small stool changes the angle enough to make elimination easier and reduce straining. Simple changes matter. Step 6. Pay attention to patterns. If weekends feel better than weekdays, if symptoms are worse when you are rushed, if the pounding only happens after straining, that is not random. Patterns are information. Write them down. Bring them to your doctor. That log may be more useful than you think. I want to tell you about a woman I'll call Denise. She was 72, widowed, independent, sharp. She told me she dreaded mornings, but she could not explain why. She said she felt off every day before breakfast. Not sick exactly, just unsteady, pressured, a little flushed, a little lightheaded. Sometimes her heart felt strange and she would sit quietly for 5 minutes until it passed. She thought this was just part of getting older. When we went through her routine, the pattern appeared almost immediately. She woke up dry, rushed to the bathroom, strained hard, held her breath, stood up too quickly, and then felt awful. Every morning, same chain, same result. Once that pattern was interrupted, the mornings changed. Not because a miracle happened, because the hidden stressor was finally identified. That is what I want you to understand. Sometimes the thing harming you is not dramatic. It is repetitive, ordinary, unquestioned, done the same way for decades. That is why it hides so well. There is another group of people who need to hear this even more urgently. Adults who have already had a heart attack, already had a mini-stroke, already been told they have plaque, already live with high blood pressure. If that is you, then this message matters even more, because your margin for error is smaller. The body may tolerate a pressure surge for years, until one day it does not, and that is often how these stories happen. Not with a warning that feels large enough, not with a dramatic moment anyone expected, just a normal morning. A closed bathroom door, a few extra minutes, and a family that never imagined something so ordinary could become fatal. I want to return to Walter. He was not careless. He was not weak. He was not ignorant in the way people usually mean that word. He simply did not know that the body he had at 71 could no longer always tolerate the strain that the body he had at 35 once shrugged off without consequence. That is the tragedy. Not just the event itself, the silence before it. The fact that nobody had explained the mechanism in plain language. Nobody had told him that constipation is not trivial in an older cardiovascular system. Nobody had told him that breath holding and forceful straining can sharply stress the heart and blood vessels. Nobody had told him that a small daily mistake, repeated often enough in the wrong body at the wrong age, can become the final trigger. Now you know. So tomorrow morning, do 3 things. Drink water if your doctor allows it. Move slowly, and do not hold your breath and strain. If it does not happen easily, stop forcing it. That one decision may matter more than you think. And if you are someone who has felt your heart pound, your vision dim, your head pressurize, or your body weaken after the bathroom, please do not brush it aside. Bring it up, talk about it, get it evaluated, especially if you are over 60, especially if you have vascular risk factors, especially if you have been telling yourself for years that it is probably nothing. Because sometimes, probably nothing is exactly how the dangerous things hide. If this message helped you, send it to one person over 60 you care about. A husband, a wife, a parent, a brother, a friend who lives alone. Not to scare them, to inform them. Because a lot of people are one explanation away from changing a habit that may be placing unnecessary strain on their heart every single morning. And if you want more plain, practical health explanations like this, subscribe now. I'm Dr. Caleb Mercer, and I want you to understand something simple but important. Many of the most dangerous health risks in later life do not begin with dramatic symptoms. They begin with ordinary habits nobody ever taught you to question.